Good morning, afternoon, and even evening to all our panelists, to all our audience today. My name is Leslie Espinosa Campomanes. I am a Peruvian indigenous descendant, pre-medical student, currently studying biomedical computation with a concentration in neuroscience and human rights at Stanford University. Today, it's an honor for me to be accompanying you starting our first international Latin American Voices of Politics conference and be leading the first panel, the healthcare systems. I am so delighted to be presenting today with such an amazing group of panelists. And just to give you a brief introduction of who I am the CEO and co-founder of ALEU, an international NGO that seeks to close the educational gaps across Latin America and the Caribbean. I'm also a Peruvian Youth Ambassador representative at the United Nations Foundation Girl Lab campaign. And today we want to be in a space for you to understand what are the necessities and what are the urgent challenges that our region is facing in regards of health. So because we know that our audience is composed by people from several backgrounds, from the diversity of majors and careers, I want you to introduce what healthcare systems is. So healthcare systems, according to the World Health Organization, is comprised by all organizations, institutions, and resources with the primary purpose to improve health across nations. Each country has its own healthcare system because they have to focus on their population's needs and all their availability. And in order to be effective, the countries have to ensure strategic policy frameworks, coalition building, regulation, system designs, and accountability, which is determined by the state, health service providers, public, private, and nonprofit institutions, as well as us, the citizens. Today, we're gonna be discovering what the foundations for healthcare systems are, what the challenges, how has healthcare systems been incorporated through this COVID-19 pandemic, and we're gonna do so with our amazing panelists, experts in the field. So I would like to start this introduction by introducing to our four panelists. Dr. Márcia Castro, the chair of the Department of Global Health and Population at the Harvard T.H. Chan School of Public Health, and the director of the Brazil Studies program of the David Rockefeller Center for Latin American Studies. Today, we also have Dr. Francisco Becerra, who is the former assistant director of the Pan American Health Organization from 2013 to 2018. Dr. Becerra has been involved in strengthening healthcare systems, focusing on research and the country's needs across the entire Latin America and the Caribbean. Today is also with us, dear Magdalena Rathe. Magdalena Rathe is a health economist and a co-founder of Plenitud Foundation, which works to strengthen health systems to achieve a more equitable and sustainable world. She also works as a coordinator of the Observatory of Health Systems of the Dominican Republic. Dr. Carlos Arosquipa. Carlos Arosquipa works as the Pan American Health Organization Sub-Regional Program for South America. He is a researcher and an author of books about global health, as well as a renowned public health professor at several Peruvian universities. Currently, Dr. Arosquipa is conducting an important work, helping create a healthcare subsidization plan in the rural frontier between Peru and Colombia. Therefore, unfortunately, Dr. Arosquipa cannot be with us today due to connectivity issues. He was very excited to join us, but he will be available for tomorrow's panel workshop. All right, since now we have all our panelists with us, let's get this panel started because we are the first panel and we are so excited to be presenting to you all. I just want to make a quick reminder to all our audience that as they can learn more about the panelists, occupations, and work, everything is on our website. So I will encourage you to check on that. And dear panelists, as we already talked with you, this is a guided dialogue discussion. So we are covering several topics and we would like to have all of you a fixed time length to answer the questions. And feel free to have opportunities to open and close discussions. Okay, as mentioned earlier, healthcare systems compromises a lot of institutions. So I would like our panelists to further explain what is going on there then. What factors do government consider when designing their healthcare systems? How is the collaboration among states, health service providers, and the citizens? Do they vary at the district, state, national, and international level? I would like all our panelists to start. Dr. Márcia Castro, do you have any opinion about this?
Thanks, Leslie, and hi, everyone. It's very exciting to be here. I'm originally from Brazil, and at some point in the past, I was just like Leslie, super excited, getting a degree and thinking about what to do next. So thanks so much for inviting me. So let me bring the sort of the example from Brazil, which is in some ways unique because it wasn't the government that designed the health system, but it was the popular movement that brought about the need to have a health system that was universal in order to address inequalities in the country. And Brazil is a very unequal country, and Latin America as a whole is a very unequal region. And here the idea was to create a system that had a compromise between the federal level, which sort of gives the guidance for the policies. The municipal level is the implementer, and then we have the state level that also supports the municipal level. So one of the main pillars of this health system is exactly this compromise between the different levels, the collaboration between the three different levels, and councils that bring the community into the decision making. So there is a voice of the community also in this model. And another pillar of the health system is equity, which makes a lot of sense if you're talking about a country with a lot of inequalities. But there are a lot of other things that needed to be taken into account. One that was never resolved, and we can talk more in a minute, is how you make a compromise between the public system and the private system in a way that the private system is not a threat to the success of the public system. But we can talk more about that in a moment.
Dear Magdalena Rathe, are you there? Would you like to compliment Dr. Márcia Castro? How is the healthcare systems in the Dominican Republic? I think you are muted. Would you mind? Yes.
Hello, everybody. I'm very happy to be here with you and with these great students from Stanford University, which are so bright and so intelligent. Well, first of all, to say that I also think that there is not a design, a specific design of the health system. In the health system, there are, and from my perspective as an economist, the WHO defines health as a state of physical and spiritual well-being. So this is a it's a lot of things around that, not only material resources, which is what economics takes into account. So we need a narrower definition of the health system. And there are so many actors and that form part of the health system, the actors which have to regulate, provide, insure, supervise, and so many markets in the health system, like pharmaceutical, health services, equipment and technology, and many times they have contradictory objectives. So someone has to regulate, and rather than designing a health system, it is the result of the interactions of these different agents. So it is difficult to modulate those interactions and achieve balance in order to focus on the well-being of the population. So it has been said that it is so complex, the health system, it has been called as an abnormal economy by some people. So it is very difficult, and the government has to do this regulation and modulate these actors in order to focus on the population. And I think that in the case of the Dominican Republic, the system, it has had a reform a few, beginning like 20 years ago, but really implemented in the last 10, 12 years, trying to achieve this universal coverage that is the international organizations are striving for. And but it is so difficult because although now with this government we have achieved 95% of the population under public financed insurance system, but which operates in a market with private and public providers and insurers. It is not necessarily that, although they are affiliated, not necessarily have all the services they need, and several of the objectives of the reform are not yet accomplished. So it is important, and it is very important that the government has this decision to make it reality.
Thank you so much, dear Magdalena. And I would like to listen also to the ideas and the opinion of Dr. Becerra.
Thank you, Leslie. Good morning. Bon dia, buenos dias. First of all, let me thank you and congratulate you for your enthusiasm and for having this panel and this conference. I think that having the youth getting involved in international issues around health is a great, great stimulation for everybody. And I think that we have to focus on that, on how the youth will help us to change and reshape health systems in the future. So muchas gracias, Leslie, for that effort, and to all the colleagues that helping you in Stanford. I think that there's as Dr. Rathe was saying, all governments are aiming towards universal health coverage. And I think that's a global thing. And I think that's something that some countries may achieve sooner than others. But we have to understand that every country is building on what they had already. So it's not like they're reshaping something and scrapping everything and trying to rebuild something from scratch. And they have to start working on what they have. So there's countries as big as Brazil that have SUS working in a very well organized way, but still they had a lot of population without coverage because there was not enough physicians until the Mais Médicos program was established. So that was a very good move. And now hopefully we have more Brazilian doctors working in those communities and expanding the access to healthcare. Then we have the changes that are happening in Dominican Republic in changing into the insurance system that is more or less what most of the Caribbean has. And that brings also some limitations in terms of how you're going to be working, because if you have very catastrophic cases, then your insurance is going to be affected in a very dramatic way. And then we have countries like Mexico and many countries in Central America, when we have a very fragmented health system. In one way, you have, in one part you have health services for open population, which are uninsured population. Then you have the social security systems for all those who work either in Mexico, for instance, in the private sector or in the governmental sector. And then still you have some state insurance systems, health systems that are only for workers of the state government. So you have a very fragmented health system. And then you have the private sector with out-of-pocket and, of course, the private insurance. So this very fragmented health systems, which are mostly in Central America and Mexico, they come back from the 40s in the last century. So these are systems that grew fragmented, started fragmented, and it's very difficult to put them all together as one health system as Brazil has. And these are more these have been health systems that are more protective in a way, that the decisions are made by the Ministry of Health, by the government, and they go all the way down. So they define the model of care depending on very such amounts of things as where to put a health system and what a health center and what kind of health center for a specific population. If it's a rural population, the health center will have certain characteristics. If it's below 2,500 people living in the community, and where the health center is, how far people can walk and reach to that health center. So that is the way a lot of model of care is designed. Of course, from the health center, the very basic one, you move into a more complex one that you might find in urban populations. And then you move to a small hospital, 30, 60 beds, so that people can reach there. And then you have a bigger hospital, over 100, 200 beds. And then you have the huge hospitals, mostly in the capitals, where you can take care of everything, or very specialized institutions like Mexico has the Institutos Nacionales, the National Health Institutes. So the finding is not unique for everybody, for each country. Each country has developed their own health system based on what they had and how are they structuring towards universal health coverage. Of course, economic resources are needed, and that's another issue there.
Thank you, Dr. Becerra. And just quoting to what you already said, each country has to distribute its resources and its healthcare systems is in regards to their own being, to their own population. So while some countries spend most of their resources in emergency plans, others do so in preventing measurements and quality of life, as Dr. Magdalena Rathe said before. So with this into account, what are the biggest challenges for healthcare systems planning, especially with a country that focuses most of its resources in a specific area, such as, for example, there are certain systems that focus on like preventing mortal diseases rather than prevention of mortal diseases, like in a delay way. So like from the children level or adolescent level, health education, etc. I would like Dr. Márcia Castro to answer this question about biggest challenges, please.
Okay. I think there are many different ways of answering that question because there are no shortage of challenges, but I think a big one are the level of inequality in the country. Dr. Becerra just mentioned, the sizes of municipalities, and you have to find a way to do what we call the regionalization of the services. You cannot have a big hospital in every small municipality. And then in times of COVID, in the middle of a pandemic, we realized that those regionalizations were not able to support all the demand for hospital care. So that's one of the big challenges, how you do the best you can with limited resources and making sure that service is available even to those people in the most isolated areas. Isolation is also another big challenge in terms of retention of health professionals in different areas. So Dr. Becerra mentioned the Mais Médicos, which kind of ended that program. That's a long story, but we can talk more about that. And it's always a challenge to make sure we have enough physicians, even in the most distant areas, to guarantee that some level of primary care is being delivered to the population. Another challenge that happens in some countries in Latin America, but also in other regions, is when you have conflicts that or violence for that matter in some cities. So some areas are not reachable because they are under the control of gangs or something like that. And then the population in those areas don't have access to the services because of that. And I think another challenge is really this tension between private care, public care, because the private system had an emphasis on specialized care. And now, at least in Brazil, a lot of the insurance programs are focusing on primary care, because Brazil basically taught a lesson that the family health strategy, which is how Brazil delivers primary care, is really a good strategy. And over 3 decades, the Brazilian health system, I think, has been the most important mechanism of reducing inequality. So this tension is complicated because, especially in the large cities, there is no incentive of expanding the public system because you have a fraction of the sort of middle higher class that wants to use the private. So just a small list of challenges. There are many more.
Thank you so much, Dr. Castro. Yes, ideally, we would like all the health resources to be distributed alongside all the population entirely. And specifically, as you just said, by closing the health accessibility gaps for minority communities, such as indigenous and rural villages. So I would like, dear Magdalena or Dr. Becerra, please to maybe tell us, how can healthcare systems and public policy overall address these communities' extreme needs? Is there any, I don't know, is there any specific strategy they should follow, or what they have to consider when like approaching these challenges, as Dr. Castro very smartly listed? Dear Magdalena, or Dr. Becerra, yes.
Yeah, gracias. I think that this, the challenges that Dr. Castro put on the table are very universal to most of the health systems. And I think that, for instance, just the earthquake that we had this morning in Haiti, that's going to have an impact on health systems as well, because probably the health center or the hospital there in the community where the earthquake struck, I think is going to be affected. So also the extra demand after the earthquake in terms of injured people is going to have a big demand on the health system. But I think that health systems have to focus on how to diminish or eliminate barriers to healthcare. And barriers can be, Leslie, in many ways. Those can be financial, that they have to pay a quota for having access to the health system. Haiti, they're charging for a delivery more than a monthly salary for a delivery in hospital. So what happens is that people have to move or have the delivery at home. Deliveries at home have a higher risk of maternal and perinatal mortality. So this is something that is happening. So when you have a financial barrier to access health care, you end up damaging population because they have to spend either out of pocket or they're in a higher risk of mortality or diseases. Maternal death will have an impact on the family, because if there are the children, those children will not have a mother. Then you can have geographical barriers, that the health center is very far away. Or if you are referring a person from a health center to a hospital and you don't have an ambulance to take that person to the hospital, it will rely on the personal resources to find a taxi, to find a vehicle, to take them from that health center to the hospital. So that's another barrier, geographical access. And then, of course, there are barriers in terms of discrimination. Rural population, indigenous population, that they may not speak the Spanish and they need an interpretation because they speak in their native language, or sexual discrimination because LGBTQ population are not well received in some health centers. So there's a lot of barriers there that have to be eliminated to really, and I think those are the challenges that health systems, on top of what Dr. Castro said, we're going to be seeing there. And of course, financing. If we depend on out-of-pocket expenditure, either half or more of the country IPV in terms of expenditures on healthcare that are coming out of pocket, that's not fair, because that means that those who have less income are paying more to have health care, either going private, or if they go to the health center, they have to go and buy the medication, or they have to buy whatever to get to the hospital because they were referred to. So there's a lot of challenges there, Leslie, that health systems have to focus on. Mostly the challenges are also for the population to reach those services.
Right. Is there anything else Dr. Magdalena would like to add?
Yes, I would like to add something regarding the Agenda 2030 and the Sustainable Development Goals, which intend to transcend the narrow view that health is about curing disease. This is all very important. It proposes that the health system should manage to articulate sectors and systems to define an active strategy for health promotion and disease prevention, and also recognizes that we live in an uncertain world with a significant increase of non-communicable diseases, risks of natural disasters like the earthquake today in Haiti, and like a few days ago, a very big storm we had here which left us millions of homes without electricity for a whole day, and it also affected Haiti, so poor Haiti. And these risks that are a result of climate change, the possibility of new pandemics that are part of this relationship between the environment and health. So it is necessary to strengthen the response capacity of the health system. So this is a major challenge in Latin American and Caribbean countries to reach universal health coverage, because there is a dynamic relationship between all the SDGs, and human beings are part of the ecosystems that support our life, and we influence them and we affect them too. So we need this systemic and holistic approach, consider all of these connections. And one of the goals, or the SDG 3 is the one devoted to health and well-being, and it says ensure healthy lives and promote well-being for all ages, and also has a target which says achieve universal health coverage, including financial risk protection, access to quality essential health services, and access to safe, effective, affordable, and quality medicines and vaccines for all. That is, to achieve that is a very great challenge, and we need to strengthen the health systems, which, as my colleagues said, they are often very fragmented and inequitable. They don't rely as heavily as we needed in primary healthcare. They don't have in my country, there is not a very functional primary healthcare and first level of care, which even if it is included in all the laws which support the health system, it is not strength enough to attend the population, all the needs of the population, and to consider all the factors that influence health. And also, of course, it is difficult to, many times the health system is not financed in the right way, and a lot of people suffer from catastrophic payments that they lead them to impoverish, or they have to have loans or lose savings, and that is not acceptable, because there is an expression that the health system should not leave no one behind, but we need to address all these challenges in order to make that a reality.
Thank you, dear Magdalena. And just because Dr. Becerra and you already mentioned, financial stability and finance stability overall is so important to address challenges. So Latin America and the Caribbean face challenges handling informal economies. As dear Magdalena already mentioned, there are so many loans, a lot of savings that has been lost too. So this unequal distribution of healthcare systems and services led to an unequal expenditure into health. For example, Colombia and Peru struggled to fund their health systems, leading to ultimately low quality and access problems. And then we're talking about inequity, right? Where are the minority people? So Doing some research, according to a comparative study of the London School of Business, in 2015, Latin American and the Caribbean countries spent from 5.27 to 9.22% of their GDP in health-related issues, being Peru with the lowest amount spent, and Uruguay with the largest amount spent. So over these last few decades, healthcare systems in Latin America have changed. They have adapted their investment strategies. And as Dr. Becerra already mentioned, there is a historical background on how the expenditures are being approached. So what do you think, now that we are with you, dear Magdalena, what do you think is the optimal investment strategy for Latin American governments to optimize their healthcare systems? Oh, you are on mute.
Sorry. Yes, it is very important the way in which the healthcare system is financed in order to achieve the goal of protecting the population. And you know, the illness is unpredictable, and sometimes it can be very costly. So it is necessary to have financial mechanisms that are based on solidarity. So that people who is ill, people who are young, for example, and healthy, can finance for those that are not. That is a way of balancing risk among several. All the population, and all the literature on health financing shows that the systems which are financed mainly with the public financing have usually better results in terms of health outcomes, and also better financial protection. That is, people are not having to confront big payments, excessive payments to regain their health. And it is said that out-of-pocket spending is the least equitable way of financing healthcare. And mostly, generally, countries which are more developed have health systems more organized and better financed and rely mostly on public spending. However, less developed countries rely a lot on this out-of-pocket spending, which is very inequitable. So, for that reason, we need to monitor this, and for that we need better ways of doing this, like health accounts, which are a system with accepted internationally, and the WHO has said that it is essential information for decision making, and they have and in health accounts. There is that indicator, as you were asking, which amount of the GDP is the best one to be assigned to finance the health system. Well, I don't think that is the best indicator. There are countries which have a very high amount, like the United States, and the results in terms of performance are better in many other developed countries which have a much less of amount of the GDP. So, and of course, this GDP percentage often includes out-of-pocket spending too. So maybe it is large, but a lot of it is financed by the pockets of the household. So it is not equitable, it is not good. So I would say that a better indicator would be the amount of public financing on the GDP, or in the total amount of health expenditure. That would be a better way of understanding, of measuring it. And generally, as I said, the countries which have a better health system have a very large proportion of its health system financing covered by the government.
Wow, that's very interesting. Is there anything else, Dr. Becerra, since you opened this discussion about finance, you would like to add?
No, Dr. Rathe he has hit it on the head of the nail. I think that's the key, to reduce out-of-pocket expenditures, to increase public expenditure in health, and to protect those with less income, for instance, in catastrophic diseases. But a good example of that was the Seguro Popular in Mexico, which already disappeared, which is a shame, because it was covering, and the money was following the patient. So no matter where you live, there will be some specific amount for you to cover primary healthcare demands. And if you had a disease that has to be covered, whatever hospital you were going, the hospital would receive the payment for that care. So, and there was also protection for catastrophic diseases. So cancer, you can go and have treatment in many hospitals. And if the state didn't have the infrastructure in the public sector, they can sign an agreement with the private sector, and they will get exactly the same amount of money that the public sector was getting for treating those patients. However, the new government eliminated the Seguro Popular, and they re-centralizing everything, all the resources at the central level in Mexico. And now we see that this is way back to the 70s, where that was the way they were doing it, everything centralized, and they will decide how to disperse that money. So on top, you have almost 2 years of pandemic, which will have a huge impact on health services and health systems. And that will bring another burden to health services and health systems. And probably the national accounts that Dr. Rathe is going to be researching is going to be giving very relevant information on how the budgets are behaving after the pandemic or during the pandemic. That is not normal financing for the health system.
In that regard, Dr. Becerra, so how does a country know how to evaluate these healthcare expenditures? Because as you mentioned, like there are multiple factors happening simultaneously. Like there are these catastrophic disease, but also you have the pandemic, but also you have like an equity system. So how a country knows when its model is right, or how can they basically build a model that can like strictly evaluate their spending
research and evidence.
Oh, I see.
You need a lot of research and evidence. Okay. Yeah, and to see and to have a lot of health economics going into this research and trying to understand from an actuarial position how many cases you might be expecting for some diseases.
Right. And
so you have to set some funding aside that will be increasing on a yearly basis to make sure that you have enough money to cover that. So you can start a trust that may help you to have that money in a better way and to increase that money on whatever the government decides to do. But you have to have very strict and hopefully legal system to make sure that the health budget is protected. Unfortunately, most countries don't have that. And the political discussions do affect health budgets. And unfortunately, social sector budgets, health, education, are the first ones to be affected in political decisions, and other sectors are improved in their budgets. So this is something that also is an inequality within the governments and the political discussion itself. Not only the inequality, of course, this will bring a lot of inequalities to the population. And you will increase those inequalities because you're not really focusing on how to deal with those.
Right. Thank you so much. Oh my God. We have learned so much in these past minutes, but I would like just to go now to some other outputs of the inefficiency in our healthcare systems. We know this COVID-19 pandemic is a great instance for that. And it has been critical test for the inefficiency in our countries. Not only our region is considered the worst economically affected, with an output fell by 7% in the GDP of their countries. compared to a 3% decrease globally, but also it has led to massive deaths. So, Dr. Castro, how has the pandemic highlighted problems in Latin America and the Caribbean healthcare systems? And what is the pandemic teaching us right now?
So I think we could spend the entire session just talking about that one question, right? So, and I think we have to break this into two parts. One is a lot of countries, unfortunately, in Latin America, and I guess Brazil and Mexico are two examples, that the problem doesn't even start with the health system per se, but it starts with a political leadership that denies science, denies truth, denies the inequalities in the country, underfund their health system. So you already start the pandemic losing, okay? So that's the problem. Then the pandemic, for sure, as any public health emergency ever in history, illuminated the inequalities in the country. And it's the most vulnerable, the worst off, the ones that pay the higher burden. So they have the higher risk of dying. They are the ones facing unemployment. Hunger is back in Brazil. So it's not just a heavy death toll, which is enough, honestly, but it's everything else that it could have been mitigated if the network of health services in primary care and community health agents, and I hope we have more time to talk about the role of community health agents, would have been used, but it wasn't. And in some places, if we were managed to avoid an even worse humanitarian crisis, was because the SUS, the health system, worked. So I guess, I mean, the answer could be much longer, but in the case of Brazil, and I believe in the case of Mexico, the problem didn't even start with the fact that the health system was underfunded, that we have all the issues of distribution of care and everything, but it started because whoever was up there making decisions denied everything that should have been taken into account. So we have a say, if there's a will, there's a way. There wasn't a will, and we didn't find a way to avoid that.
Wow, it's so unfortunate to listen to that, but that's what we learn, and we learn the hard way. All right.
I hope we learned. I hope we learned.
I know all our audience today are learning with us, since we are, the future leaders of this region. We're gonna make better decisions, hopefully. All right. So I am so delighted to be today accompanied by researchers, because more than just public health advocates, advisors, and super intelligent and well-known representatives in several distinguishable areas, they are researchers. So they base all of their knowledge through data. And as we've been talking, right, it's been like social, economical challenges and calls for action for Latin America and the Caribbean healthcare systems planning. However, there are some countries, especially as some of our panelists already mentioned, developed countries that are using data science and are using technology for prevention, future health emergencies such as the next pandemic, because we never know when it's going to happen. And also these data demographics can help us like getting to prevent or stigmatize how it's gonna be like a next disease, or which probabilities certain populations might have for disease prevalence, for example. So I would like, since we've been talking with Dr. Castro about this earlier too, and Dr. Becerra mentioning about research-based evidence, have you heard on any Latin American or Caribbean country using data science into their health systems, Dr. Castro? And if you know about this, do you know about what projects they are designing, and overall why it is so important to introduce technology and data into health-related issues?
So Leslie, information is power, right? If you don't know it, you can fix it. So that's the basic. So I wouldn't say I know of a country, but I know places in countries doing this. So we have examples in Brazil that they're using, for example, cell phone data combined with administrative records to build models in order to guide action to minimize the burden on the vulnerable. There is one city, a capital city in the northeast of Brazil, that they use a model like this to deploy contact tracing before things got out of control. It was working until the hospital system collapsed. There are different databases to track immunization and trying to make sure that people that live in the periphery of cities get vaccinated. Again, in some cities, not at the national level. So there are different ones, and basically the places doing this are the places that made collaborations with local universities in the cities. So they're leveraging the knowledge that is being generated by science and bringing that into policy. So fortunately, we have some of those examples. I wish they were at the national level, but I think we have plenty happening, and we need to bring those to light and give voice to those things that are happening because they're really important and they're saving lives.
Wow, you just mentioned something so important, such as collaboration with the education partnership too, right? Like how universities can play such a huge role, especially like the students themselves. They are doing research all the time. Why not incorporating their insights into public health organizations? Is there anything else, maybe dear Magdalena, if you would like to add about any?
Yes, definitely. I think that data science is essential to improve performance in the healthcare system, because decision-making needs to be based on evidence. And in the case of the healthcare, the data corresponds to the totality of the population, the thousands of health problems and conditions that can affect them, every age group, every demographic group. So imagine that. So, and there are also physical infrastructure, financial resources. It is a society as a whole. Only in the case of financing alone, just to give some examples on the sources of finances, just a very little aspect of health financing. You need to have information on which sources finance it, the type of taxes they are how they are collected, the progressivity or regressivity of those taxes, the contributions on salaries, how to and premiums in the case of the insurance, and out-of-pocket payments. In the case of the providers, there's a lot of different types of providers, and they provide so many different services. All that is information, and it is required very, very large. The insurers they have to pay the providers. They need information on each person insured and what problems they have along the whole healthcare system, what they use, what for which conditions. So it is data science is an absolute necessity.
Thank you, dear Magdalena. Dr. Becerra, you brought this topic into the conversation, so I would really like to listen to your opinion.
No, thank you. I think that both Dr. Castro and Dr. Rathe have discussed it very widely, but I think that this is a critical issue, and unfortunately, we see it more at the local level than at the national level. National level is focusing mostly on epidemiological data and the number of vaccines supplied, and they're not really having a strategy, especially Mexico and Brazil, which most of the decisions have been political. And just an example, in Mexico, we have this 4-color coded light system. In terms of green, if everything is open and everybody can move, then you move into yellow with some restrictions, then you move to orange, and then you move into red, which is the highest restrictions. So it's based on a series of factors, which is the number of cases getting into the hospital, number of people getting into ICU that are intubated. So the Ministry of Health comes with a red sign for Mexico City. The governor of Mexico City says it's orange. And the one who finally decides is the president and says it's orange. That's it. Of course, Mexico City is a big city. Mexico City is the center of the federal government. Mexico is celebrating the 500 years that the Spaniards came and conquered Mexico, Tenochtitlan, 500 years ago. So they were going to have a huge festivity, and they did have it last night. So the Zócalo, the main plaza in Mexico, in the center of Mexico City, is packed. Was packed with people being there celebrating, no social distancing. I bet that many of those didn't have any face masks. So you can imagine the spike of cases we're going to be seeing in the days to come. We have hit records of over 25,000 cases detected in one day. And we are not doing a lot of tests in Mexico, as the United States is doing or other countries are doing. So we are going to see, and the curve is going high, and we are not doing any data analysis. We're not using a lot of data to really control and take decisions and make decisions in the way we should around the pandemic, which has been mostly politically managed and decided.
Yeah. And this is, I think this is the cruel reality when data science has a lot of potential to subsidize issues and like prevent issues, but then also the policy frameworks has a lot of responsibility for that to happen. All right, so dear panelists, you know, we are approaching to the end, but I know this session has been very informative, very encouraging, and very interesting. And we as a student now, I am so excited. I'm currently a student, and I would like to participate more eagerly and actively and getting involved into healthcare systems. So I really would like you to maybe give us some advice on how we as students can participate in this role. Dr. Castro, I would like to hear you.
So, I mean, first of all, I think everybody should read history, because a lot of the roots for the problems we have are in history, and you know, I can see from some younger people in Brazil, and I wish they would read more, understand the history of some of the structural inequalities we have. I think that matters. The other thing is we need to exercise critical thinking, and we can't just take truths for granted, but we need to ask questions. And you are all young, you should ask as many questions as you want and make up your minds based on the answers to those questions. It's not criticism, it's critical thinking. We need that. We need a lot of that in the world nowadays. And you guys have to continue to do what you're doing now, building up this conference, engaging into conversations, engaging with people that are doing research, and speak up. And, you know, in some countries, you have mechanisms for the community to be heard. Engage in your own community. You know, all my work, a lot of friends of mine work by talking to ministers. I don't talk to ministers. I do everything on the ground, make enough noise, then the minister will listen. So do that, you know, engage with the local community. And nobody knows better the problems than those people facing the problems in the community. So that's the best way to start. It's to learn the problems, engage with them, and then try to make things happen from the bottom up. Value science, value truth, and be yourselves the mechanisms of change. And the best tool you have to promote change, folks, is the vote. So critical thinking, voting well, you can make a lot of change, and you can be true leaders in the future.
Thank you so much, Dr. Castro. Learn, engage, act from the bottom up. I'll keep that forever. Dr. Becerra, is there any other ways we can participate in healthcare systems planning for you?
I think that you're in the early stages of your career and deciding what you're going to be doing in a professional life. And I think that those who might be interested in health and healthcare, you can really start building your path towards that specifically. Of course, you can support that from the research point of view. So you became researchers in health systems, and you can really provide a lot of evidence towards decision making. If you want to go into government, then you will have to have connections in politics, and you will be a politician yourself to try to connect and to try to get into a decision making position. Sometimes it happens, and sometimes you have to go through a party or whatever, which is the way in some countries. And you have seen how politicized the Ministry of Health post is. I mean, in just 1 year during the pandemic, Peru changed about 3 or 4 ministries of health. And that's, I mean, just to say something, how politicized health is. Sometimes they say that health is not related to politics. No, health is politics all the way to the core. And we have to understand that as well. But I think that you, young people, you have to start looking into the path you're going to be walking to the future. And I think that this is a great start, Leslie. And I think that you, that has created an international NGO, you could talk a lot about it, not us, because you know what it is to engage young population, to work to support other young people that are in need. So I think that you already know that. You have it in your heart, you have it in your soul. And I think that all the girls that are working with you in that NGO, they're the same in that regard, and that the future for the region. And I think that this is something that has to start in an early age, and you are doing the right way. And I hope that most or many of the young population students that are listening to this in Stanford or other countries that joined can do the same. Involve more into the country's problems. Get involved more into understanding the inequities. Get more involved into understanding those vulnerable populations, and get more involved in how can you help and not think about yourself only. So I think that this is a very good start to have more young people and the youth of the Latin America and the Caribbean joining us and trying to see something for the future for this region.
Thank you so much, Dr. Becerra. My heart and I am blowing up a lot right now. Thank you, thank you, thank you. Dear Magdalena, is there any message you would like to give to all the youth that is listening to you and like literally are going to be the change makers of the present, because the future is kind of late, but no, we're doing it right now.
I think they have said almost everything. They are so inspiring. I agree with all of them. And I think you are doing the right thing, trying to involve all these young people of every career, of not only people from public health or medical areas, but every path of professional work. The health system is so broad. It's like, as I said before, like society as a whole. So there is a need of interdisciplinary approaches. People from very, very different areas can be involved in different things depending on their own interests. As you said, data people, mathematicians, engineers, not only medical people. A lot of paths of career can have a place, and the important thing is to be interested, is to be try to make good questions and try to obtain better answers, and also be talk to people, try to engage people, and then I'm sure you're going to be the leaders, the very, very excellent leaders for the future.
Thank you so much, dear Magdalena. As you might know, we have an audience that is composed by people from several backgrounds, not necessarily only on the health area or political science area. So is there any last message you would like to give to these people that are currently so eager to participate? Because I think they already made the first step, which is entering to this conference, getting to know to your career, and also getting to know more about our continent. So is there any other last message you would like?
Yes. Well, you know, yesterday, I think I was looking at a press conference that gave our president, Luis Abinader, to a group of journalists, because he is having his first year of government. And he said he had just been talking with Joseph Stiglitz, who is a Nobel Prize in economics, on which areas he could advise to help people raise about poverty. And he said, Stiglitz said that help people with health financing, education, and public transportation. So I liked it very much because at the same conclusion we arrived several decades ago when I was just after I finalized university. One of my first research jobs was research on the distributive impact of public spending. And we arrived to the same conclusion. Health was the most, which had the bigger impact to reduce poverty. So I think that fact and the fact that I saw that the out-of-pocket spending was so high in this country and it was so inequitable, those two areas were the foundation that I decided to dedicate my life to this area of study. So I think that it is good. It is a good. We have in our organization, for example, we have a motto: this transforming research into action for the creation of an equitable and sustainable world. And I think that is, I believe, this is an aspiration that is worth dedicating one's life.
Thank you, dear Magdalena. Oh, I just got some, I was looking up into the Q&A, and our youth are truly listening to you and they are getting so inspired by your message. And I know we have a little of time to answer some of the questions. So I would encourage our panelists to read through the questions that has been sent into our Q&A and feel free to just answer to any of them. There are so many that are receiving a lot of likes. So I think a lot of people are interested about these questions. So maybe we can go through the first question that says, oh, Dr. Castro, go ahead.
Yeah, it's in Portuguese. I can answer that one. So the question is about, it talks about the Brazilian health system and it's been considered as a model. So what's the future perspective for the health in Brazil, considering the question disappeared. What happened?
I think it's going into
you moved it. Okay. Considering the fact that the public healthcare and primary care is being defunded and weakened, and if this can affect the health systems in other Latin American countries. So that's a very good question. So as I mentioned, the health system was underfunded even before the pandemic started. And before the pandemic, there was a lot of conversations in trying to come up with a system of privatizing. So like the popular health insurance, which really would be a disaster. It would be leaving a lot of people behind without any kind of care. So we really need a change in leadership. I'm sorry to say, but I can't see how this government will make a commitment to invest in the health system, to invest in primary care, and it really to make the health system, even if it makes it like it was before the budget was frozen, would be better than what it is now. The threats to other countries, I'm not so sure about it, because the health system in Brazil was so different from other countries in terms of its universality and comprehensiveness and composition. But I really hope that we can at least get the community health agents back into work as they were before the pandemic started. They are trusted by the community. They reach the vulnerable community. Not only they can bring care, but they can bring information at a time when there is a lot of misinformation circulating in the area. So I think we need a change in leadership to value the health system we have. And I don't think Brazil has room for a different system than what it has now, than the SUS, because before SUS, we had a big fraction of the population that depended on philanthropy, charity, to be able to access care. So there was no primary care for those people. They would basically reach a hospital when they were very sick. So we cannot go back to that. We would go back 35 years, and there's no way we can do this. But so bottom line is we need a change in thinking at the top to be able to have a system that provides for those that are most in need and cannot afford anything else other than the public system.
Thank you so much, Dr. Castro. Is there any other question, Dr. Becerra or Dr. Rathe, that would like to answer from the Q&A?
Yes, I think that there's a couple of them that are touching about mental health. And I think that that's a very important question. I think that, first of all, mental health in Latin America and all we Latinos, we mostly don't talk about mental health issues. It's kind of a taboo. It's kind of something that if you discuss it openly, is going to put some mark on you that you are crazy and or something like that. That's one part of it. The other part is that health services or health personnel in primary healthcare don't have the tools or the expertise to detect mental health issues and how to deal with them before they grow into something bigger. And I think that it's a huge opportunity for health services to start working on that field. And mainly because the long-term COVID, or the name you would like to post for after COVID, after acute COVID and long-term COVID, mental health issues are high as one of the symptoms that are coming out of COVID. So you have obsessive compulsive disorders, you have anxiety, you have depression, you have issues in sleeping, all those are few of the mental health issues that we're gonna be seeing as an increase after COVID. So if health systems are not prepared to deal with those, we're gonna see a lot of problems in the community because we are not addressing these mental health issues and we're not recognizing. So this is again an opportunity for health services and systems to start implementing tools for primary healthcare physicians to detect and treat mental health issues. Of course, it's going to bring a lot of issues around it, but we have to start working on those. And it's a huge opportunity for Latin America to do it.
Thank you so much. Yes, and I think unfortunately we don't cover these topics, although like it's so prevalent. And I think it's also because of information, as we've been talking throughout the panel, right? We lack on information. We lack that these necessities are also need to be meant and like be meaningful for our governments. But well, Dr.
No, it's true. It's true. And I think that this is when you are seeing a problem and you don't react and start planning for it. And the other one is the aging of the population in Latin America. This region, and Dr. Castro is working in demographic, she will know exactly. This region is aging at a faster pace than Europe did. So we're going to see a lot of old people, me included, because I think I'm already above that threshold, and I'm already in the senior group. We are aging in a very fast pace, and this will bring also a burden on health systems, and we have not reacted and planned accordingly.
Right. Okay. I think we have some other questions about. Okay. I think there was some questions in terms of like how can we incorporate intersectionalities with people from different sexual orientations into these discussions too, and why these became very taboo topics. So I don't know if someone has any opinion or any answer about this, because yes, our continent has been, I would say, taboo in this regard, but we all have to also look for solutions towards all communities within our region. So is there anybody that would like to answer? So it's
sure. I think that I also brought this issue in one of my answers in terms of the vulnerable populations, and I think that this group is very vulnerable in many ways. And even though the Pan American Health Organization voted on a resolution to facilitate access to LGTB populations, I think that has not been reached in many countries. And I think this is also more on how families grow and how communities think about these issues, and how the government has to bring some more education, open discussions, open debates, that it doesn't matter what you decide in your sexual life or how you want to be. This is a personal decision and has to be respected. And as a person, as an individual, you have to be respected, independently of whatever your sexual orientation or your sexual decision your life is. And I think that there's a lot of taboo, there's a lot of fear, and there's a lot of misinterpretation of these things, that discussions in the community don't really make it easy for these populations to have access to healthcare. And of course, many healthcare personnel do not know how to deal with these issues. And there's also a need of training health staff to understand these issues on how to treat this vulnerable group. And I think there's a lot of work as well as I said, in mental health, because this will bring mental health issues to the people who are not having access to healthcare, who are discriminated, who have to be ostracized in a small group because they cannot go out and do their lives.
Right.
I agree. And if I may add something, I think that for those things to happen, we need a climate that is respectful of human rights. And at least in the case of Brazil, we are going backwards in that direction. We had years when everything was done in the right direction. We passed a legislation that trans could change their legal names. They could have surgery to change sex free of charge in the public system. We had a lot of progress, and now we live at a time that it's not easy for those groups really to seek care and be themselves, because we're losing achievements we had in terms of human rights. So it's a challenge.
Okay, we got another very good question. It's in Spanish, but I can translate it. I would love to know how nonprofit, non-governmental, and civil organizations can also be participating in the construction of public policies in healthcare. Does anyone want to answer how non-profit organizations, civil organizations can be involved?
Well, I would say that definitely they have a very important role in all these issues. I am the founder of a non-governmental organization, not for profit, which aims to, as I said before, for a equitable and sustainable world. And what we try to do is we are more oriented to research and transform research into action. So it's not just academic research to publish papers. It is we want to have evidence in order that the people who have the decisions can make the policy decisions with the good information. And also non-for-profit organizations work on advocacy. For example, what you have just said, human rights for LGBT populations, for populations with mental health problems, with difficulties accessing the health system, and for a lot of vulnerable and excluded communities, there is a need of advocacy for them. So I think apart from those who work directly providing the services, which are lots of non-for-profit organizations working on that. So it is a very wide range of possibilities for them.
Thank you so much, dear Magdalena. Dr. Becerra would like to answer another question.
Thank you, Leslie. I think that there's a very good question that Catherine Perez Acuña is posting. And it's in Spanish, but I'll translate it. Is scientific evidence the only way to make a decision or an important decision in health? It is probably the base for decision making, But there's so many factors that you have to consider in health, like culture. Is it going to be culturally accepted? Political. Is it, and again, political issues also play a part in decision making. Is it going to be popular or not? So you have to consider a lot of issues around the decision or the evidence that you have, because the evidence might be very good, but then is it feasible to be implemented? Do you have the resources? Do you have the means? Do you have the health services available to do that in that population or in that community? So you have to consider all the factors around the implementation of what you are going to make the decision about. And one of them is cultural, political, feasibility, and feasibility in terms of financial, in terms of everything. So you have to take all this in consideration whenever you are planning to have a decision or to implement something in health.
Right. And I think there was another very similar question in that regard. What kind of, I think it was from Giovanna. What should we be researching about when we talk about healthcare for immigrants and refugees, or minorities, I would say, in Brazil and in Latin America? I think that would be an amazing closing question. So we get some action items for our audience too, to start working on after this panel. Is there maybe Dr. Castro, if you would like to recommend us?
So sure. So in the case of Brazil, I think the question mentioned Brazil. So we have an issue in the border with Venezuela. So there are a lot of studies going on in terms of healthcare for mothers. There are a lot of pregnant mothers coming into and delivering in Brazil. So healthcare for women and child's health is a big area of research. The other one is the infectious diseases. So measles and malaria are two big important ones when we talk about this. Housing conditions overall, where are those migrants or refugees, where are they staying? What are the housing conditions that can affect their health and the health of the place where they are? That interaction is important. But there's also a lot of, for the folks in social sciences, there are a lot of need for anthropology, qualitative studies to really understand the interactions between the migrants, the community, the place where they are, and to help them relocate. If they get refugee status, they relocate and be able to start a new life where they are. So honestly, I bet that every major of people in this meeting right now can have a role in trying to understand and contributing to better health, better engagement of migrants, and so on. We need everybody. Seriously, social sciences, health sciences, economics, everything has a role when you're talking about public health.
Leslie, and very quickly, because we know you're going to be closing, but I think that is a key issue. It's not only affecting Brazil, it's affecting probably the whole continent, because we have a lot of people migrating because of drought, because of political issues, because of hunger, because of work. And so it's not only Venezuelans, it's a lot of people from Central America trying to get into Mexico, to go to the United States. So all these migrants are moving, and they're moving with children, they're moving with pregnant mothers, and they're having a lot of issues around healthcare and healthcare delivery that they will need in their movement. And all the issues that Dr. Castro mentioned are also there, but I think there's a lot of ways to engage and support these populations.
Dr. Rathe, you would like to answer also this question about what research we should be doing to advocate for minorities?
Well, in the Dominican Republic, we have also the same problem, because we have a lot of migrants, mainly from Haiti, but also from other countries. And a lot of population from the Dominican Republic goes to the United States. For example, there are like 1 million or more Dominicans in the United States, and they go to Europe. So, as Dr. Becerra said, this is something that is going to happen more and more with this climate change crisis, droughts and problems like that. This is people who want to have a better life and move searching for that. So I think it is also an important human rights issue, and there have to be we have to respond to that. We have to acknowledge that and be open to satisfy their needs too.
Thank you so much. Well, I would like to thank you, like from very deep in my heart. I learned so much today, and I'm very sure all of my folks in the audience learned as well. I'm so delighted once again to be spending this important time with you. And I'm so delighted that this conference is bringing people that know about these issues and just getting us inspired on what to do next for our region. So thank you so much. This was the Healthcare Systems panel. Thank you.
Thank you so much. I will send out to the chat for the participants a feedback form that we're also using for the people who need certificates to track their assistance in the conference.
Thank you to all of these amazing panelists. I would also like to highlight that we have three other panels, I'm sorry. I think one topic that was mainly brought up in this panel is health inequalities and health inequities. And the next panel we will have is actually the health inequalities panel. So I invite you all to come to this panel. It will happen in a couple of hours because right now we're going to take a lunch break to accommodate the time zones. And right after this, we will also have our panelist workshops. So if you apply to a panelist workshop, you should have received the link yesterday. And if you haven't, just email us and we'll make sure to just send that to you. But right after the panelist workshops, we'll come back to the same Zoom room and have our three next panels, which are the Health Inequalities panel, the Career Workshop panel, and the Maternal and Reproductive Health panel. Thank you very much.